Welcome to Pregnancy and Birth Diaries. Today we will be talking about stretch marks. Why on earth do they happen? Do they go away? How to prevent them and what you can do to treat them. So, stretch marks start showing mainly on our belly, abdominal area, breasts, hips, thighs, and buttocks. So, as our skin starts stretching, as our body starts to grow to make space for our developing baby, stretch marks start appearing. And they appear when the skin is stretched beyond its normal limits and the underlying connective tissue breaks down. So, for example, when I touch my stretch marks, I can feel that there is a tissue that broke apart, kind of like torn underneath the skin itself. During my pregnancy and after birth, for about a year, they were darker in color, more purple than red, but now they're not that visible, but I can definitely feel the cracks in the tissue. So, this is also called scar tissue, which appears as streaks on our skin surface. So, in the beginning, they are more visible, but over time, they kind of fade away. So maybe you have already heard that some women get away with a few marks that become invisible over time, and some women have a lot of them and they are basically there to stay. What I'm about to say might not be entirely what you want to hear, but based on talking to a lot of women, I came to realize that it is mainly genetics. For example, in my first pregnancy, I didn't even know that stretch marks were a thing, and I didn't do anything, no creams or oils, and I didn't get any stretch marks at all. Zero. In my second pregnancy, I had a few of them just underneath my belly, and as I mentioned, they are almost invisible. But at the same time, I know women who used special creams to prevent it, and they believe that it helped, but not entirely. And some women report no results at all. So, main factors could be genetics, a family history of stretch marks can increase the likelihood of developing them during pregnancy, rapid weight gain during pregnancy. It puts like additional strain on the skin. For example, I did actually put on a lot of weight in the later stages of my second pregnancy. I was eating a lot of sweets for some reason, to the point where urine tests showed glucose, which is not normal, and I didn't have diabetes. So I believe that's when the marks appeared, because prior to that, I had not noticed any. And of course, multiple pregnancies, because when women have multiple babies or have a large baby, they are more likely to have stretch marks. There's also something about hormonal fluctuations, because when we have increased level of estrogen and cortisone, they weaken the skin's elasticity and make it more prone to stretching and tearing. So let's talk about possible ways of prevention. It is difficult to prevent stretch marks entirely, but you can moisturize regularly the skin with creams or oils that contain hydrating ingredients like cocoa butter, shea butter, almond oil, or vitamin E. By keeping the skin well hydrated, you can improve its elasticity and reduce the likelihood of stretch marks. I would personally also try to put on weight gradually and steadily. It's easier said than done, but gosh, like I would definitely avoid eating so much sugar like I did the last time. So I would focus on a diet that is rich in vitamins and minerals and antioxidants to support my skin health. And of course, I would try to stay hydrated. It was impossible until the third trimester because of nausea, but I would do my best to try to sip water, tiny drops, as often as possible to keep the skin hydrated from the inside out. And also try to improve circulation of your body and to promote skin elasticity. For example, exercises, but consult with your doctor before you do any exercise during pregnancy. I think it also helps when you wear supportive clothing. There are like maternity clothing that provide adequate support to the growing belly, and that might help minimize skin stretching. Now, what can you do if you already have stretch marks? As I have mentioned, stretch marks usually do fade away over time, but they might not completely disappear. So there are over the counter creams that contain retinoids, hyaluronic acid, which can help reduce the appearance of stretch marks. There are also professional treatments like laser therapy or microdermabrasion or chemical peels that are performed by dermatologists or plastic surgeons that can help minimize the appearance of stretch marks. But I personally would do thorough research and talk to women and professionals before actually doing them in order to prevent any side effects or end up having more problems than they were before. There's also such a thing as like cosmetical camouflage, like makeup, self tanning products that can be used temporarily to mask the appearance of stretch marks. I think it's also important to mention the emotional impact of stretch marks. We know that stretch marks are a natural part of pregnancy, but they can have a significant emotional impact on us because it's in our nature to want to look good and to take care of our appearance, to be attractive. And this is completely normal. And there are reasons for that from an evolutionary perspective. So I think it's important to have self compassion and to focus on the incredible journey of pregnancy and motherhood. If you are having any body image issues and concerns during after pregnancy, it is important to talk to your doctor or counselor and address these issues. All right, that is it for today. Stay well, and I will see you next time.